Welcome to tonight's webinar, The Hollywood Laser Peel with Dr. Candace Thornton-Spann, sponsored by Lutronic. All phones are on mute for the entire presentation and live demonstration. During the presentation, please place your questions in the GoToWebinar control panel. All questions will be answered at the end of the patient demonstration. At this time, I would like to introduce Dr. Spann. Dr. Thornton-Spann is a board-certified dermatologist in Las Vegas. She treats various skin conditions and offers skin rejuvenation treatments. As co-owner of Couture Dermatology and Plastic Surgery, she offers both dermatologic surgery for the removal of both cancerous and benign lesions and is an expert in skin rejuvenation. For patients seeking cosmetic skin treatments, she offers countless non-surgical treatment options for the signs of aging. Dr. Spann, I will now hand over the controls to you.
Thank you so much, and thank you for having me. It's an honor to be speaking on behalf of one of my favorite devices. We're talking today about the Hollywood Laser Peel by Spectra. I'd love to start by telling a little story about when my husband and I first opened our practice about 5 years ago. We had a patient who happened to be an esthetician in another busy practice, and she was talking to us about what we should invest in for our new practice. And she said to us that everybody in that other practice agreed that if there was ever a fire, that they would all run in, grab their Spectra laser, and then leave the office. So that was all the convincing that my husband and I needed. That was really the best testimony we felt like that anybody could give us. So today, we'll start by focusing on the Hollywood Laser Peel. This is something that's unique to the Spectra laser. This has become so popular in my practice. It is quick, it's easy. In fact, we're going to show you a little bit later just how easy it is. It's affordable and great for your practice, for all of the providers that are listening, because it's something that can be delegated to either mid-levels or estheticians, and really something that's enjoyed by all. So let's talk a little bit more in depth about what that is. The Hollywood Laser Peel is something that's really helpful for patient retention. The statistic came out within the last year or so that patients will spend somewhere on average of about $170 within 24 hours of leaving your practice. So a lot of us, especially as physicians, tend to be a little bit reticent to recommend procedures. We're worried about having people spend too much money. Keep in mind that if they're not spending it with you, they're going someplace else. So this is a great product that is cost effective and a way to keep patients in your practice. It also promotes something that's great to promote to potential new patients. We've had several open house events where we were sponsored with food and beverages, and we generated a lot of interest and attention for patients, especially once they found out that this is something that's easy with really no downtime. So the open house was a great way to introduce it to new people. There's an opportunity to upsell. In fact, what you'll hear me talk about in my consultation is that I like to suggest that we use something like the Hollywood Laser Peel to jumpstart the improvement that the patients are looking for, especially if they have an upcoming event, and we'll talk more about that later. And as I mentioned earlier, it's something that can be delegated. This is something that my esthetician takes care of for me, so it's a great revenue stream for the practice without me actually having to give up my time. So what exactly is the Hollywood Laser Peel, you're probably asking right now? Well, this is laser energy that is combined. It's both a Q-switched and long pulsed and DYAG. And in using this combination with a carbon lotion to start, we reduce visible skin pigmentation, we improve skin tone, we improve uneven pigment. And it's something that's done so easily. You'll see in our demonstration that we apply the carbon lotion, which is very attractive to the laser, and in doing so, the laser stimulates turnover of the outer layers of cells. and really facilitates that nice glow that we're looking for. Also, the carbon lotion is allowed to sit, so it goes deeper in, and with the longer pulsed laser, we go down into the dermis, which stimulates the collagen and allows for almost an immediate skin contraction. So this is an example of what the patient looks like before she's covered in the carbon lotion. Typically, patients start to see improvement really after the first one, and I tell them that after the second one is when things really start to get good. So dyschromia is improved, the skin looks younger, it looks more rejuvenated. You do get that exfoliation of the stratum corneum, so you will see that it does help with the glow that everybody's looking for. Again, it stimulates collagen, and it reduces sebum. One benefit that we've noticed is that patients who tend to feel that their skin is oily or shiny find that their skin just ends up having a glow without looking like it's greasy or shiny all the time. We've noticed that with multiple treatments that we get a sustained softening of the skin tone, an improvement of skin texture. Again, we're continuing to regenerate collagen. One of my favorite benefits is the reduction in pore size. How many of us as dermatologists have patients who come in and say, I hate my large pores, what can we do? And this is a safe, easy, effective way to help to reduce pore size. And it does also give a nice improvement in fine lines and wrinkles. So getting a little bit into the technical aspect of what's happening, we use this patented carbon lotion. We put the carbon lotion first on the patient's face, and we let that sit for about 15 minutes. Now this is important because as the carbon lotion sits, it's drawn into the pores, even to the level of the sebaceous gland. The carbon lotion is very attractive to the laser, so when we do the long pulsed version, we get which is called Spectra mode, we get the thermal effect. The lotion is not removed, but we get a thermal effect that results in heating of the carbon lotion and therefore of the follicles. And then we switch, we never remove the carbon lotion, we switch the setting to the Q-switched mode. And when we do that, the Q-switched firing of the laser actually removes the lotion, and in doing so, unclogs the clogged pores. And it's pretty exciting. We'll show you that in just a few minutes in the demonstration. So the consultation process is very important with any patient that you're going to introduce this to. I always like to conduct a very thorough history. I want to know about any medications that the patients are using, especially medications that could be potentially photosensitizing. And I'm also very interested in the patient's sun protection practices, particularly if they're coming in because they're concerned about hyperpigmentation. I always suggest to them that if they're going to be spending money to improve hyperpigmentation, it doesn't make sense, particularly with us being in Las Vegas, that they go right back out into the sun and end up exacerbating the hyperpigmentation. So very important that we have a thorough history and understanding of the patient. I do a thorough physical exam, noting underlying issues, especially acne or melasma. It's important to keep expectations realistic, and if a patient comes in with a face full of acne and really severe melasma and they're expecting with one Hollywood laser peel to have flawless skin, of course you're going to have a disappointed patient. So I try to design a treatment regimen that's very comprehensive to really give optimal results. If the patients have hormonal acne, then we address the hormonal acne. If we have melasma, then we will address the melasma and maybe even introduce the Hollywood laser peel as a way of jump-starting their skin regimen, and maybe even introducing it and continuing on to more extensive treatments with the Spectra laser, for example, if the patient does have melasma or acne. So why is this so beneficial? There's no downtime. It's safe for, I'm going to say, all skin types. We've done this on 1 through 6 skin types with really no problems. It's quick, it's comfortable. The patients like that they do get some immediate benefit, and then that the benefits continue, especially as we continue on in the series of treatments. And you know, this is such a funny generation that we're experiencing now, because We've had the advent of people who've become YouTube stars, and we have this obsession with celebrities, and everybody's on their internet and Facebook and Snapchat and all of these things. And so really everybody has a chance to be a star these days. So not only is the Hollywood laser peel used by the stars before going to the Oscars and is it the celebrity go-to treatment, but this is a go-to treatment for everybody, whether you're getting married or you're going to a class reunion or you have an important meeting, or if you just want to feel fabulous, this is a great treatment that's easy to do. It's something that's become popular. We're hearing about it all the time. We're seeing it on TV, we're seeing it on the internet. And so this is really a great procedure to introduce into your practice. One great thing about the Lutronic team is that they are really supportive, and so they're happy to keep you well stocked with signs and pamphlets and to generate that online presence that helps to drive patients into your office. One thing that we found to be particularly effective in our office is the patient brochures, not only for the Hollywood laser peel, but actually for all of the different procedures that we offer related to the Spectra peel, because it's helpful to explain a little bit why this laser is different from every other laser that they might get at any strip mall or med spa on the street. So here is a before and after picture of one of my patients. She came in with really severe melasma, severe acne, and just looking to have an overall improvement and glow to her skin. And she was very pleased, even after the first Hollywood laser peel. And interestingly, she has continued her treatment. She ended up getting the full acne laser system and then the full melasma laser system. So she's actually continued to improve and has been very pleased with her results every step of the way. And speaking of patient retention, our work on her with the Spectra laser has made her a patient here for the whole almost 5 years that we've been here in practice. So let's talk a little bit about the Spectra system as a whole. It does have multiple handpieces and applications, and for those of you who are either just opening a practice or if you are in practice but looking to expand into the cosmetic realm, this is a really good first choice laser because there are so many problems that you can address with the one platform. So the Spectra laser is an ND-YAG laser. It has both the 1064 and 532 wavelengths that come standard. In addition, it has options for the 585 and the 650. It does operate, as I've mentioned previously, in both the Q switched, which is the 5 nanosecond, and the Spectra mode, which is the 300 microsecond mode. The beam profile uses this top hat mode that we'll demonstrate in just a few minutes. It's really almost foolproof. It's very easy to use. The pulse energy goes to a max of 1.2 joules, and the pulse widths go from 5 to 10 nanoseconds in Q switched mode or in the Spectra mode. The max spot size is 8 millimeters, so it allows you to treat larger spot sizes and even some larger vessels. Pulse rate max is 10 hertz. And it uses an external auto calibration. It really is quite easy. We'll show you from turning the system on to using it how easy it is to use. Oh, and that's a picture of what it looks like. Lasers for treating melasma. This is a question that everybody has. I think melasma is probably one of the most frustrating problems that we encounter as dermatologists. And this is one of the few treatments that is actually FDA cleared, one of the few lasers that's actually FDA cleared in treating melasma. In fact, nanopulse ND-YAG laser is the gold standard for treating moderate to deep pigment disorders and melasma. So these are the indications for Spectra. So going back to my original statement, I love this because it is such a useful platform in so many areas. We've been very effective in treating tattoos, including the colored tattoos with the trickier blues and greens that are hard to remove. As I mentioned, it is a treatment for melasma, for post-inflammatory hyperpigmentation. The Hollywood peel is fantastic for skin rejuvenation. It's one of my go-tos for active acne. because it does target both inflammation and clogged pores. For post-acne erythema, there's the optional gold handpiece that's really effective for that. We use it for the nevus of Oda, for lentigo, for freckles. For the macular seborrheic keratosis, I do actually like it. And this is great for the treatment of large pores, as I've mentioned. So the Spectra handpieces, the two that come standard are the 3 to 8 millimeter zoom collimated and the 1 to 7 millimeter zoom collimated. Optional, especially if you're doing a lot of tattoo removal, you have the 585, which is great for the sky blue tattoos, and you have the 650 nanometer, which is great for green tattoos, and then the golden handpiece that I mentioned, the 585 gold, is great for the redness, especially for post-inflammatory erythema. I'll demonstrate this for you in just a second, but the handpiece has an auto recognition feature, meaning that when you adjust the spot size on the handpiece, it automatically is adjusted in the laser itself, so you really don't have much opportunity to make a mistake. And it does ensure that the fluence matches the output that's delivered. So how is this different? Because there are a lot of ND YAGs that are on the market. So what would draw you to the Spectra laser? The nice thing is that it gives less lateral thermal damage. That means that where you are targeting the skin, that's exactly where you get that maximum delivery of energy. That's important because it minimizes the reduce of post-inflammatory hyperpigmentation, and it also minimizes that recurrence that you'll see so frequently with a lot of other lasers during melasma treatments. And it's very effective. We've been able to remove tattoos quite effectively with this laser. In a lot of the other Q-switched products, they might have a longer pulse width, up to 20 nanoseconds, so you can see that you don't get that peak delivery of energy. You get a more inconsistent delivery of energy, which can lead to a lot more side effects. So, as we've mentioned earlier, this does have both Q-switched and long pulse energies available. The Q-switched mode gives you the 5 to 10 nanosecond short pulse. So that shorter pulse width gives you the higher peak power. This is great for breaking down or removing the chromophore, whether we're talking about for tattoo removal or melasma or for the laser peel. We've even done an epidermal peel just using this mode. And this just shows the explosion of the particle that takes place at that 5 nanometer second, particularly useful for dermal melasma and for tattoo removal. The Spectra mode is the quasi-long pulsed mode, and that's the longer pulse width. So that's the one that we use first, for example, when we're doing the Hollywood peel to give that thermal effect where we're heating all of the skin. That's where you really see the benefit of the skin rejuvenation. So it's nice to compare thermodynamically the Spectra laser to other lasers that offer this same type of an ND YAG. So the Spectra laser gives a very even distribution of energy. There's not an irregular distribution. You can see here that the whole thing is really yellow, which means that the intensity is just kind of moderate intensity. You don't see areas where it's really lighting up as being bright red centrally. Whereas with other products, for example, it's low intensity centrally, maybe higher intensity where you get that spread of energy, and that's where you see patients that are coming back burned unintentionally with other lasers. So looking at some before and after pictures from our treatments with the Spectra, this is one of our patients who had such severe melasma, and I have particularly enjoyed working on this lady. Of course, now this was about 10 treatments ago, and she's had about 10 more treatments since then. And her whole persona has transformed. Her melasma was so severe that it really affected her every emotion, state of mind, decision. She would come in kind of with her head down. She didn't really want to interact with you too much because she was just so embarrassed. And she had one of the most advanced cases of mixed melasma that I've seen. You can see even here in this after picture that her epidermal melasma has cleared, her dermal melasma has significantly lightened, and as an added benefit, her acne has cleared quite nicely, and her dermal melasma has continued to improve with subsequent treatments. And just really, every time I see her, because the esthetician does the treatments, but every time I see her in the hall, it's big hugs and big smiles, and it's really very rewarding to be able to offer a treatment like this to somebody who has such a frustrating problem. This is another one of my patients, and I love this lady because she really exemplifies what can be combined, what can be achieved when you combine treatments. So she has had several chemical peels. I'm a fan of the PCA peel regimen, and that's helped a lot with everything else. But the Spectra laser was what I used to clear up both her adult acne and her really persistent dermal pigmentation. So with the combination of the two, she's been just thrilled with her results. And the benefits don't end here. I mentioned before that the Spectra laser is one of my favorite go-to treatments for treating inflammatory acne. This has been so beneficial, especially for parents who aren't really ready to commit to Accutane. They like the idea of using an acne laser that both targets the sebaceous gland, reduces bacteria and oil at the level of the sebaceous gland, and unclogs the clogged pores. And the patient sees such a nice benefit with this without having any of the unwanted systemic side effects that you can see with isotretinoin, for example. And this even demonstrates in an even more inflammatory case where not only do we have a reduction of the inflammatory papules and pustules, but you can see that the erythema has been greatly reduced, and also a minimization of the patient's pore size. This is after 6 sessions. This comedonal forehead acne is definitely a yeast-based type of acne, so I will combine this treatment with something like fluconazole, but I've even done this on my own daughter. I have a 13-year-old daughter who suffers with this type of acne, and we've seen this clear where even retinoids tend to fail with this type of acne, so it's nice to have this type of an adjunctive treatment to offer that, again, doesn't hurt, doesn't really have any downtime. It's just a really nice benefit to the patients. And here's a patient who's had both acne and severe hyperpigmentation. This is a fantastic result. I think you'd agree. This is a patient who has type 4 skin and really struggled with hyperpigmentation. And by using the 1064 mode, the hyperpigmentation was cleared without leaving residual hypopigmentation or even hyperpigmentation in the surrounding areas. And here's a patient that I think everybody would just knee-jerk want to put on isotretinoin. So it's so nice to see that this kind of reduction of inflammation is possible. There was the combination of the Spectra mode and the Q-switched mode that I was mentioning earlier for the Hollywood peel, used in combination with the carbon lotion in order to get this kind of a nice result. Again, with 0 systemic side effects and no real downtime. We always get worried when we get to the type 5 or 6 patients. So this shows you a beautiful result treating both acne and hyperpigmentation. This is 3 sessions, 1 month after 3 sessions, using both the Q-switched and long-pulsed NDAG with the carbon lotion. Really a beautiful result. You can imagine how this changes somebody's life. And another example of clearing up acne. So this is really great to show people what to expect because you do see a progressive improvement. So even after, so they were cleared after 3 sessions of their acne, and then the gold toning with that optional gold hand piece that I mentioned was used to help to begin to clear that post-inflammatory erythema, because P. acnes is such a frustrating bacteria. Even long after it's killed, it continues to exhibit these cytokines that create the erythema in the skin. So this is really a useful a useful a way to reduce that erythema for patients, because it is so embarrassing and so frustrating. One of my favorite things to do is to use this to treat enlarged pores. And I think that's because for so long, patients would come to me asking for a way to reduce pore sizes. And I would put them on retinoids and kind of hope for the best. But this is one way that they're actually seeing improvement even after one treatment. And here's another example of that. And a magnified example so you can really see the benefit here. And again. This is huge. This is devastating for people, so it's really nice to offer this kind of treatment. That was 3 sessions in order to get that kind of a result. So now that you know everything that you need to know about the Spectra laser, let's go ahead and shift gears, and we'll show you the demonstration of the Hollywood peel. So you're seeing Danielle on camera and our wonderful esthetician extraordinaire, Tonya. Tonya's just turned on the Spectra laser. I don't know if we can show the laser at all. It's going to warm up for a second. But it's really foolproof, and I'd like to demonstrate that top hat beam mode that we were talking about. Of course, Danielle, our patient, has already been prepped. Her face has been cleaned before we got started, and the carbon lotion was applied just at the beginning of my talk. So what was that, about 15, 20 minutes that it's been sitting there. You can see that Tonya is adjusting the fluence of the laser. And take the handpiece for me, Tonya, please. And you can see that she's already selected the 8mm spot size on the laser and on the handpiece. As you do that, it changes on the screen. So I've selected 8. It's already recognizing it as being 8 millimeters on the screen, and we have it set first to Spectra mode. So remember, this is the mode. This is the long pulse mode, quasi-long pulse mode. And so Tonya is going to begin creating that thermal heating of the skin. Everybody needs to put their goggles on, please, in the room. Thank you so much. I can hold the vacuum for you if you'd like. So we use the vacuum just to evacuate any little minor smoke that might come. On the skin. You can see that the beam on the handpiece is controlled by this top hat, so it ensures the right size. And Tonya's going to go ahead and get started. So as she goes all over, you'll notice that the carbon lotion is never removed, but we're getting a nice thermal heating of the skin. Okay, how are you feeling, Danielle? Good. Good. Any pain? No, none at all. No pain at all. So this is very easy. And again, something that's so nice to offer, because this is not something that I do. Tonya does this for me. So it's a way to retain patients, and also it generates a nice revenue stream for the practice, and it gives the patients an easy treatment with no downtime. Okay. So you can see that Danielle's tolerating this beautifully. It's not painful. She is getting a nice thermal heating all over her skin. Why don't we go to the other side? We'll maybe not finish the whole thing, and then we can switch to the Q switch mode in order to demonstrate removing the. So again, so easy, no pain, just a few minutes to get the carbon lotion, just for the laser to follow the carbon lotion down to the level even of the sebaceous gland. But you'll notice that we are not wiping off the carbon lotion, and we never remove the carbon lotion as a matter of fact. Now we're going to switch gears. We're going to switch to the Q-switched mode. And Tonia's adjusting the fluids. And with the Q-switched mode, go ahead. With the Q-switched mode, even though we never wipe off the carbon lotion, as I mentioned, the laser itself removes the lotion. Sorry, a little softer, Danielle. And you can see that the lotion is being removed even though we're not wiping it off. And that's great because it also unclogs the clogged pores, minimizes pore size. Really does a nice job of stimulating that dermal collagen. How are you pain-wise, Danielle? No pain at all. So again, this is a great treatment to jumpstart whatever it is that the patient desires, whether it's rejuvenating skin, reducing pigmentation, tightening collagen, and if they just want to look fabulous for their wedding, their reunion, their important meeting with the boss, whatever it is that's going on. This is just an easy, effective, fun way. And you can see Tonia's about 2/3 of the way done already. We usually warn people that it's a little bit loud, but it doesn't hurt. Of course, with any Q-switched or long pulse Nd:YAG, it's important to have protective eyewear. So all of us in the room do have on our protective eyewear because of the pigment that's targeted. So you can see how fast this is. This is easily something that people could come in on their lunch break and get it done, you know, before whatever their important event is or whatever it is that they want to look fantastic. That's basically the entire treatment. Now, one thing that we will do if the patient has some active acne or something that requires immediate attention, we might switch back to the long pulsed mode and go over their acne spots, and that helps to reduce active acne. In fact, because it's so anti-inflammatory, usually takes those pimples down, as well as doing a steroid injection without the risk of atrophy. So that's another big selling point for people. How were you pain-wise, Danielle?
Really no pain at all.
Really no pain at all. You tolerated it beautifully, easy to do. Very good. Okay, great, perfect. And you look 10 years young. No, I'm just kidding. Now you look like you're 12. So that was really great. Why don't we turn off the laser? I think there might be some questions and answers from the attendees.
Thank you so much, Dr. Span. It's such a thorough presentation.
My pleasure.
We do have a few questions for you.
Okay.
How does Spectra compare to Pico laser?
As a business owner, of course, for me, I have to always think about return on investment. And so while the Pico laser does offer standard, I think they have the 755 nanometer wavelength, and then they do have the 1064 and the 532 Nd:YAG wavelengths. They operate at 1/1,000,000th of a second, so it is a very powerful laser. Cost is an issue, though. For me, it was much more economical, especially because when I purchased the Spectra laser, we were just opening a new practice. It's much more economical for me to purchase a laser that has all of these capabilities and really great results. And I do like that controlled wavelength that I was mentioning with the, or controlled spot size that I was mentioning, and energy with the Spectra laser. So I think that we, with the Spectra, get results that approach or are equivalent to the pico lasers, but it's significantly less of a price for our practice. And so it was something that I had to really be cognizant of. I also love that besides the carbon lotion, this doesn't have consumables. So we paid for this laser, but we don't have to continue to pay for the laser on and on, like with a lot of the other lasers that are on the market.
Thank you so much. How much should I charge for the various Spectra procedures?
I'm in Las Vegas, so of course your price is going to depend on your market. I think everything's more expensive maybe in New York City, for example. But we charge, if we're going to do, we try to encourage patients to do practice packages because we know that they'll get the most benefit. So if they just want to have one Hollywood peel, for example, that's $400. But we like to encourage them to do a package of 3. And if they do the package of 3, we incentivize them by charging $1,000 for the package of 3. There are lots of other procedures that we offer. For example, if we're doing telangiectasias, it might be $50 for each telangiectasia that we're treating with the Spectra. If we're doing melasma treatments, it's $200 per treatment. We encourage them to do a package of 10. So it's $1,000, thank you, for the package of 10. I think it's a good idea to talk to your rep to kind of get a feel for what's appropriate for your market, but that just gives you an idea of what the prices are in Las Vegas.
Thank you. There are reports of speckled pigmentation post-Hollywood peel procedures. What are your take on this?
I haven't seen a lot of the speckling with the Hollywood laser. I have seen it with quite a few of the other ND YAGs that are on the market, and I think that's again because we have that controlled uniform distribution of energy. I do encourage patients, particularly if they're concerned about hyperpigmentation, to use either a hydroquinone compound or even to combine it with chemical peels to help to minimize that. And certainly you do want to be cognizant of how much you heat the patient's skin. A lot of people will use other modalities, including IPL, and we know that it's the heat from the IPL that seems to result in that speckled hyperpigmentation, sometimes with the unevenly distributed ND YAGs, we do see that more, but it's been something that we've been able to control very well in our practice.
Thank you. How about the parameter for Asian patients? Do you need to reduce the power?
No, well, I should take that back. Of course, every patient is treated as an individual regardless of their Fitzpatrick skin type, and it's really about what the patients tolerate. I myself have had this done in exactly the same settings that we just used on Danielle, and my Fitzpatrick is a little bit darker than that of an Asian patient. It tends to be tolerated well by everybody because that 1064 nanometer wavelength is important. That goes deeper into the dermis. It doesn't settle out in the epidermis where you end up accidentally burning patients.
Thank you. How often are you scheduling the Hollywood peel?
We like to do one treatment every 2 to 4 weeks. Ideally, no more than 4 weeks should pass in between the peels.
Thank you. How many Spectra peel procedures do you perform each week?
In our office, we're doing somewhere between 20 to 30. Well, the honest answer is that I don't do any anymore, thank goodness. That's something that Tonya does for us. And again, that's important if you're the dermatologist, because your time is better spent doing other procedures. So I frankly don't do any of the Spectra or the Hollywood peels anymore. That's something that Tonya does for me. And I think you do about 20 to 30 per week in our office.
Thank you. How are the effects of this peel settings for periorbital hyperpigmentation?
For periorbital hyperpigmentation, particularly if you're talking about like the nevus of Ito or something like that where it's dermal pigmentation, I find that we need to be a little bit more aggressive than doing just the Hollywood peel. So that's the kind where we would do the package of 10, like the woman that I showed you in the demo, or even extend that. I think she's had between 20 and 30 of those laser treatments at this point. And that's where we really are focused on doing the laser toning. So we'll use the carbon lotion 1 week and not use the carbon lotion the following week so that we can get consistent, deeper pigmentation. I almost have to treat those like a tattoo. And so it's more aggressive than what we just did.
Thank you. Do you package the Spectra peel with any other treatments?
We are big on packaging everything. And so we will, if we see a patient who we know would benefit from both the Spectra peel and chemical peels, for example, like the one patient that I showed you, we will do packages of both together. We're certainly not trying to break the bank. But again, as I mentioned, we know that if we're not effective in capturing and treating the patients here, that they're going to go someplace else to get something that might not be as effective. So we do try to be mindful of budgets, and we do package things together.
Thank you. Have you ever used the Spectra mode for laser hair epilation?
I don't find that it's fantastic for laser hair ablation unless we're talking about just the fine vellus hairs, but it only goes to 1.2, and so it doesn't seem to be quite hardy enough to really get laser hair removal if you're talking about somebody who's either suffering from hirsutism or they're looking to remove the axillary hair or pubic hair or something like that. I don't find it to be really effective for that.
Thank you. Do you use Spectra for active acne or acne redness? And if so, how well does it work?
We love the Spectra for active acne and acne redness. I'm not sure if you saw during the presentation, but it's been a really nice adjunct to treatment for patients who have active acne. It's also been a kind of a saving grace for the kids, teenagers who need isotretinoin but whose parents will not agree to it. We've used the Spectra laser quite effectively to reduce the severe inflammatory acne without having any of the systemic side effects that can go along with isotretinoin or even some of the other acne treatments. It's very effective.
Great. I believe that is all of our questions for this evening. I would like to thank you, Dr. Span, for a wonderful presentation. If anyone has any questions, if anyone has any questions post-presentation, you can go to www.lutronic.com. Thank you so much and have a great evening.
Thank you.